Good morning, everybody. It's 10:08, and we'd like to remind the committee members that once we go through the agenda, you do have an opinion, please voice them. And how about James and his crew? So with the icebreaker, it would be, what is your favorite DUI do-it-yourself project? And pronounce your name, which is George. I'm co-chair with Maria. I'm on this committee, and my favorite DUI would be if I was to be putting in shelves for a house if I owned one. And I would pass it on to Susan.
Susan Garcia with the Community Health Centers of Lane County. I'm a community partner, and I've been racking my mind with how do I respond. I guess the only thing I could come up with is like organizing cabinets and shelves and stuff. I don't know. Let's go with James.
Oh, yes. Oh, dear. Yes. James Barda, he, him. I'm engagement strategies coordinator here at Oregon Eligibility Partnership, and I help facilitate along with George. And also along with George, I think you said shelves. It sounds sad and humble, which is what it is. But I know anytime I moved into an apartment in my younger days, I would put up a set of shelves. So that was just a thing I did. And I'll pass it to Maria.
Good morning, Maria Park, Senior Program Manager, Asian Health and Service Center, co-chair here with George. Anything IKEA, I will make it all.
Oh my gosh, this is a miracle woman.
I love to make things. Okay, I'm going to pass it to Judith.
Well, I too love organizing things. I mean, it could be anything. And I like to find things that work in an organizing, like how do you reuse a vitamin bottle? And how do you reuse a prescription bottle? Oh, let's find something to do with that. So that's my favorite thing. And I will call on Dion.
Hello, everyone. Dion Destin, he, him, and my pronouns. I'm executive support with OEP. My DIY lately really has been around meal planning, just in general, but I never really did that before. But now trying to, find ways to reduce carbs and sugars and bad stuff that I'll actually, with the caveat that I'll actually still enjoy and eat it. So that's been mine lately. And I will kick it over to Vanessa.
Hi guys, Vanessa Broadley. I am the Community Engagement Coordinator, South Coast Regional Early Learning Hub. Excited to be part of this team. And I am obsessed with DIY. We move so often. I love to build out custom closets anytime we move into a new house. I love building like libraries wherever we live. I always like having like a electronic free area. If you need a new kitchen, give me a call. This new house, I took up a tree. There is no DIY too big or too small. YouTube University, handing out certificates daily. I love me my YouTube University. So yeah, there's nothing I will or will not do. From cars to home, I do it all. And I'll popcorn to Samantha.
Well, I am the queen of, I started a DIY project and then got busy and couldn't finish it. Vanessa's gonna die right now because I have, my mudroom has a bunch of wallpaper that I purchased to remodel my bathroom. Not done. We took down the front porch and steps to my house last September, and then it took 4 months for the contractor to do the foundation work that needed done. So that was not our fault. We now have a porch, but we don't have steps up to it yet. So that's half done. I have so many trees that need trimmed. Vanessa, please come save me. But I will say the one DIY project that I have started, completed, and taught other people successfully was for Girl Scouts, the cadets, that's middle school age, have to have a woodworking badge. And my kids decided they wanted to do that. But at the middle school level, we're not allowed to have them using power tools. So everything has to be hand tools. So we made camping chairs using like hand saws, hand drilling, hand screwing things in. We had to sew the canvas seats and staple them on. So it was hard, but the girls managed to build their own, learn how to use tools and build their own chairs in about an hour and 15 minutes. So that was my number one DIY. Those chairs are very cute and they still bring them to everything. So I will pass it on to Veronica.
Good morning. I am Veronica Kritsky, the BA for the Oregon One mobile app. My favorite DIYs is probably going to be anything party decor. My husband does woodworking, but with his help, I did build a workbench for our son. So he has like a little kid-sized workbench in his room with his toy power tools and stuff. So yeah, that's probably my favorite one because that actually gets to stand around for memories, because with the party decor, you kind of take it down and put it in storage and don't see it again. I will pass it to Paul.
Paul Alderson. I am the public services representative for the applicant portal team. DIY. Oh, it depends on what's going on at the time. Currently, right now, I've been working in my front yard. I put probably 15 bags of dirt in and built some drainage with river rock this weekend. So that was this weekend. Oh, and I also took down 2 dead branches out of a huge tree. I'm kind of the jack of all trades. I kind of will jump in and do whatever is necessary. Let's see. Who hasn't gone? Andrew, are you here?
I'm here.
Let's go to Andrew then.
So I would say my favorite DIY is probably baking and cooking. Baking, particularly like pies and pastries, things like that. But the DIY project I'm currently working on is more similar to Paul's project, redoing my landscaping in my front yard, adding an additional layer to our retaining wall, waiting on some delivery of what I assume to be a very heavy pallet of brick stone things to finish that, and then adding some sort of river rock for drainage and to help the weed problem we've had, which is Italian bluebells. I think if anyone's familiar with those, they're very annoying, and I've tried for I think 3 years now to weed them as best as I could, and I've given up, and I'm going to try and cover them with landscaping fabric and very heavy rock to see if that helps anything. Sydney, have you gone yet?
I have not. I'll go ahead and jump in, and it's great timing because like Andrew and Dion, my DIY is also just in the kitchen, cooking, mostly food. As a hopefully one day homeowner, I will maybe enter my Vanessa level DIY era, but it's not me yet. So anywho, I'll pass it on to April.
What organization are you in, Sydney?
Oh, Neighbor Impact in Central Oregon.
Okay.
April Paul. I also work for Neighbor Impact Childcare Resources. I manage the Baby Promise program here. Much like Sydney and Andrew, I've just been baking lately. We got air conditioning in January, so I use my oven now in the summertime. I've never had central AC. Prior to that, it's pulling weeds, and I used to design weddings. So now I just bake sourdough bread. So I will popcorn to James. Did you go already?
I did, but we have a couple more people. Randy?
Good morning. I'm Brandy. I'm from OEP Central Coordinations. My favorite DIY is I do a lot of baking as well, but I do a lot of crafts and making things. I like making, I have like a tiny small business that I make different things out of, but I have a famous sign that my mom bought me to put in my office that says, "Why buy it for 10 if I can make it for 73?" So that's what I live and die by. So, and I honestly have no idea who's gone, so you might have to help me out, James.
Azucena? Is that everyone after? Anyway, go ahead, Azucena. Sorry.
All right, Susana Moreno, pronoun she, her, ella. I am the OEP, the Equity and Engagement Strategy Manager with Oregon Eligibility Partnership. I'm not a big DIYer, like I just never got into it. I have a house, it's probably falling apart. We did buy bookshelves, so now we have like a library kind of in our house, and I really love this DIY project because my husband did it all for me. So that's what I like to see. And that's I guess it for me.
Okay, it looks like that's everybody. We'd like to remind everybody that we have a long agenda. Some things are going to be taking a little bit more time than others because of what's on the agenda. James, you're in the seat now.
Wow. One of these days, you can hand it straight to Andrew, George, because he's going to give us our recap.
All right, so request 79, updating the wording of the alternate format options for notice, the alternate format options for notice correspondences and informational menus. That is logged and currently scheduled for the November 12th build. Request 90, defect, it was, rather than being logged as one of our work items for this work group, it was taken as a defect, 390122. Updating the language of CCO selection and previous CCO selection to preferred CCO and previous CCO preference. Change request 800363, which was one of the CRs that this group voted to move forward, and this is to allow for self-scheduling in the online portal, and in addition to that, making some scheduling updates on our worker side as well. And that's scheduled for March 2026, so next March, and we are currently in the trenches with that one in our JAD meetings, and yeah, I think Maria and NJ have been participating in those as well. So we've had some great input from this group, and moving along with that, it's great to see a CR from this group start to come to fruition. So yeah, we're excited to show everybody, I think, in the future once we kind of get things finalized.
Cool. Yeah, 79 we did just last month, by the way, too. So it's moving right along. But wait, there's more.
Request 77, which we will talk about part 2 today. Excuse me. Part 1, which was clarifying the layout of the screen on kind of which section of the screen belonged to each household member there. That is also currently logged and scheduled for November 12th.
Which leads us right into our next agenda item, which is the other parts of request 77.
Yep. So with the part 2 of request 77 is talking about that very bottom section of that page, and we can look at the briefing sheet to see exactly what we're talking about here. But it shouldn't be brand new to anyone who's been here in the last 3, maybe even 4 meetings. But looking at the wording on when individuals select the options for being temporarily away or living part-time in the household or not living in the household, there's a number of different options there to select. none of which are particularly clear on exactly what that's, when you would want to select any of those. So efforts to try and make that more clear. And in our conversations leading up to this meeting, it sounded like the group has leaned towards adding some explanatory text in the existing help text icons. So we can see the first question here is Rari living with Serenity? And just to clarify, Rari is a name used for a person on the case. Serenity is the name used for the head of household on the case. So we're asking, is this person living with the head of household? That help text that exists there explains when you would want to select yes part-time, no temporarily away, but it doesn't particularly explain all of these options below that you would choose in sequence after having answered that first question, these subsequent questions. So that's what we're hoping to clarify, is that box. Why is Rari listed on the case? And right now, currently, the help text on that question is very limited. I believe it just says select one or more options, something like that. Let me look exactly at what it says. Select all values that are true. So I think what we're wanting to do is when, for each one of those options that's selected in that first question, expand on that second help text to explain, to use these this new proposed help text that James has on screen here. Maybe helpful to kind of pop this into chat so I can do that.
So just, to speak about this, the restate, I guess, a little bit, that right now the help text is very limited for this screen. So this is what we're going to be adding, is in that help text, these explanations for all these different little things here. What is that? 8 different items, well, at least 8 different items. And it's a mix of making it understandable and also restrictions of how we have to define it for policy. And thanks for putting all that into the chat, Andrew.
So that's for the first one. There's three different answers that we want to look at. And so this is for the first one, no temporarily away. So these are descriptions of what each of these options would mean. And this is pulled from state resources, our service manual and different eligibility guides that our workers use. So these are, it's each option and the outcome of selecting that option, or why an individual will select that option, essentially.
I think the big question to ask committee members is, does that text that I'm showing on the screen that Andrew put in the chat, it makes sense?
Which one is that one?
Say that again, George?
Which one is that? I don't see it.
This is for if the person, who, we're asking, is this person living in the household with the head of household? And the answer is no, they're temporarily away. These are the 8 options that he put in.
Okay, so what do you want us to do?
So we're wondering, is this text here that would appear in the info box, when you click on the question mark, a text box shows up. And we're thinking of putting all these 8 items, starting with rules of shelter all the way down to child is away due to family emergency, and if only. Does it even make sense? And I see Susan has already asked a good question, or made a good point of not the rules of shelter is still a little mysterious.
Yeah, so my understanding of that one in particular is there's certain, for instance, like a domestic violence shelter or different recovery shelters that once a person enters, they may be asked to stay there for, a 30 to 60, 90-day period. But they would still technically be considered part of that household, but due to the rules of that shelter, they're staying in that shelter for that duration, for that time period.
Is there a selection section to select between these 1, 2, 3, 4, 5, 6, 7, 8 items?
Yep, I'm gonna scroll back up to that screenshot. Okay. So those 8 items are all here.
So that's what that is.
Yep.
So
see-
guys,
oh,
so
go ahead.
guys, what do you think? What's your opinion on this?
Well, and Susan, did that answer your question about shelter? Is there a way we can reword it to be a little more clear?
I'm not sure, maybe the people who live in the shelter would know or have family members. Just,
How about rules of a shelter? Because that defines, if you go back where it says rules of shelter, rules of a shelter. So if that kind of pops it like that is a place instead of just a word that is explaining it. I don't know what everybody else thinks, but it was just a thought.
Yeah, that's true. It sounds like, not a rules of shelter, it's just rules of taking care of someone as opposed to a physical place.
Well, shelter could be hiding under a tree, or shelter
Yeah.
from the rain, I just thought maybe that might work.
Yeah, because A does stand for one shelter, and of could be a number of shelters.
Yeah, I think that's something we can include in our proposal. One, I don't see this being as like a big stopping point for anybody, but I think if we're changing, so I think in adding the help text and the descriptions is going to be a little easier than changing the actual on-screen options that we're selecting from, because those have been like specifically decided on by policy. Now that said, I think adding an A in there isn't going to be anything super groundbreaking. I just wanted to kind of preface that that part of the ask will then we'll want to make sure that policy reviews it as well to approve it. But I don't think it's going to be a deal breaker.
So what does everybody think?
Yeah, and Maria put in some text as well. Dimensions of the shelter they're staying in. Maria, can you comment on your idea there?
Oh, maybe just adding the due to the rules might make more sense, maybe. I'm not sure if it was just the rules of shelter that didn't make sense or if it was the description.
Would it just be regards to the duration of a day or could you elaborate?
I mean, I think it's to answer your question, I don't think so. I think really what this is asking is like, what is what is the reason this person's outside of your house? And like, I don't think some of these shelters would be like holding people against their will from returning to their home. But I think if they're complying with like a certain program, like a recovery program or a domestic violence safety plan or something like that, they may be asked to stay for a specific duration before returning to their household or something like that. So yeah, I don't think there's other rules or regulations we need to consider, just really the reason that they're not currently in the home.
Andrew, does that mean that we need to add facility in there, or maybe rules of a shelter or facility? Well,
We could.
Is adding a fancier word? Do we, are we talking about adding it to this text here?
I think maybe more to the description.
Okay.
Fixing, Veronica?
A shelter facility here.
What do you guys think? Brandy? April? Sydney, what do you think?
Welcome, Vixen.
I'm okay with it. This is Judy.
oh, maybe add or shelter or facility.
Do people not understand? Is there a significant difference from the two, or?
What I think what I'm hearing Maria maybe getting at is like if it's the difference between different, like someone who's staying in a domestic violence shelter may think of it as a shelter, someone staying in some other sort of like, if it's like drug
Rehab
recovery
facility,
or
right?
outpatient recovery or something, it may be, they may think of it more as a facility rather than a shelter.
Right.
Something like that.
I like it like that with the and or.
Down here in caring for a sick individual, away due to caring to individual emergency needs, I would put caring for a sick individual, meaning one individual, away due to caring to an individual's emergent needs. Because that would sound to me really appropriate, because you're looking caring for a, meaning one.
So again, just a little update to the actual wording on the option that we're selecting. Yeah, and I think the reason these are worded the way they are currently is for brevity, to kind of limit the amount of space that we're using in that upper selection box. That said, again, I don't think adding a there is really going to be a deal breaker on anything if that makes it more clear.
Well, if you really look at it, if you've got caring for sick individual, that may or may not have people thinking, well, how many individuals are they actually talking about?
I mean, well, does it matter though? How many, if they're caring for one or they're caring for three? For the purpose of this, it doesn't really matter, I'm guessing.
Yeah, it doesn't really. It's really asking, is caring for any sick individual the reason that you're not currently in your household, or the reason that person's not currently in their household?
Okay. Who's phone number 382? Or 582?
I'm not sure, and
Okay.
they can see all this on their phone.
Yeah, someone's got,
Any, sorry, George.
looks like someone's got a phone number 971 582 or 382.
Oh, phone number. It says 971 582.
Yeah.
Yeah, I assume someone needed to call in rather than join on the Zoom link. So
Yeah.
So what else do you want us to do, Andrew?
so we have a couple more things to share. If there's no other updates needed to this section, we need to talk about the below section for no, which I can share the text there.
Okay, we're gonna roll on here. At least this one only has 4 options.
So an individual may be considered part of the household when they are deceased, when they are same tax filing group, when they are spouse or dependents for service eligibility. And there's also an option here for no reason applies. And one of the asks, or one of the notes I think we had from before, is rewording currently it says no reason apply, and we want to grammatically fix that to no reason applies. Or the other option would be no reasons apply. One of those two.
We got the big questions, either no reasons apply or no reason applies. Where do we make the big bucks here?
That's okay. I'm still stuck on this deceased one thing. That's like freaky.
Yeah, so that is particular to medical benefits. You can people who have passed away can have retroactive benefits up to 3 months to cover medical that they were receiving during that time.
Maria says it is unapplicable.
So real quick, so no reasons apply. Is that what it's talking about? Like unapplicable or not applicable, like NA, is that what it's asking?
Yeah, essentially it's saying that none of these other, someone is listed on the case, but they're not living in the household, asking why they're listed on the case, and then we're given these reasons. They're deceased, they're in the same tax filing group, or their spouse or dependents for service eligibility. If none of those reasons would apply and they still are listed on the case, the person would select this option.
And they don't need to know, do they need to have like an other and write down some other thing, or?
I think we would leave that, at that point, we would leave it up to our eligibility workers to kind of explore further. Because I mean, I think ideally, if none of these reasons apply, we want them to be removed from the case. If they're not in the household, but we're also not asking the person to make their own eligibility decisions like that. So. It could just say other if that makes more sense.
Vanessa, what do you think?
I mean, I just keeping it simple and easy because like this isn't like he said that this isn't gonna trigger anything automatically other than for an eligibility worker to gather additional information. So whatever option is clear, or I think maybe no previously listed reason applies.
I mean, isn't usually, I'm not the voting member here, but isn't it usually like other reason? Is that how you usually do these sorts of things?
Susan says, I think it should say other, since they might have a reason. It just isn't listed.
Well, if you want them to list something that may not be in there, then other would be good, other reason. But if that's not what we're talking about, then no reason. Is that what we're talking about, or are we talking about anything else?
I think we're talking, yeah, it could be, it's not clear. Like we're, it could be anything. There could be no reason that they were left on the case. The person just doesn't know they don't need to include them. But none of the options provided apply. So I think essentially for what we're looking for here, whether or not we want to include, like why this, giving us some more information about why this person's been left on the case. Essentially, I think other and no reason apply mean the same thing here. It's just a matter of what makes more sense to someone who's going to be reading this. And I could really go either way. If we feel other is better or other reason not listed, then I say we go for that.
I like the word other. I think it's something more used in a 6th grade, 7th grade language. And I think it's more commonly used. I think it would be easier to understand that that's what we were giving them the opportunity to say. Now, is this for the client or is this for the worker?
Information for the worker,
Yeah.
to know, why
Okay.
this person was still
Well-
that, like when they're processing the case, why this person was still left on the case.
Well, if it's for the worker, I'd say it's just fine the way it is.
What the screen is
Yeah,
for
sorry,
users.
the screen is for users, the information is for workers. So I guess the answer to your question is both. But what we're going for is what makes the most sense to someone using this screen to convey that information to a worker.
Well, then it should be, I think other would be better.
Okay, and then that leaves us with other or other reason not listed. Do you think just
other reason not listed? Yeah. What is the consensus from the group?
I agree, Judith.
Okay, thank you.
Vixen, April, Randy, Sydney. What's your take on this? Anybody?
Is this where we are also thinking having like parentheses? Is this if this person is no longer in your household, please consider removing them from the case or kind of something to that effect?
could you say that again?
So we talked about before, like, why is this person listed on this case other and like maybe wording saying if this person is no longer in your household and the previous selections do not fit, please consider removing them from your case, or because they might have not seen remove household member and they're saying, oh no, they're not living with me anymore, and thinking that will remove them or somehow indicate that they are not there.
Mm-hmm.
I don't know. It's too many words, but
No, I get what you're getting at though. Maybe some dynamic text that displays when they select either no temporarily weigh in no that says like you said, if none of these reasons apply, consider removing this person from your case.
Okay, Andrew, is this all that you need from us? Because we need to move on.
Sorry, George, there's a little bit more that we need to confirm on this item before we can move on.
And Maria,
So I acknowledge it's taking a lot longer than I had planned for, but I think it's important we get a decision on this one today.
So you want to vote?
We still have a little bit more to cover before we can vote.
Maria,
What is, I have two questions. What is within certification period?
So if they were deceased within the period they were you were receiving benefits, or that you're applying for benefits. So like we wouldn't want them to include someone who had passed away 12 months ago, but we would want someone they would want them to potentially include someone who had passed away up to 3 months ago.
So like within eligibility period, coverage period, or is that talking about like the death certificate period, or like the coverage period?
Like in the period that they're requesting benefits from the state.
Oh, okay. I kind of feel like maybe that might not make sense for some people. Maybe if there's a way that we could explain that.
Yeah.
But the other question, sorry, was I thought normally if someone's not supposed to be on the application, then they would let us know, right? Like, let's say, for example, they'll like kind of let us, when we help our clients to apply, they'll let us know like, oh, they need to apply separately or something like that.
I mean, there's a whole screen that they answer questions about deceased household members, but it doesn't come until after this current screen.
Oh, sorry, separate question. So like
I'm sorry.
Going back to what Susan was saying, I was just thinking that, yes, sometimes we will report that we need to remove a household member, but then sometimes they'll always also let us know like if we need to remove a household member. I don't know if that makes sense, but anyways.
I think I get what, yeah. I think it'd be, so you're asking if there could be like something saying that you need to include somebody?
No.
I don't think I'm understanding. I'm sorry.
It's okay. We can move on.
Oh, are you sure? I feel bad. I think I can understand you. I just might have missed it.
Well, okay. So for the first one, maybe we can start with the first one, which is just within the certification period. Is it just me, or does that make sense for everyone else?
No, it doesn't.
Yeah, I think we can clarify. We should clarify that if everyone agrees. But it's a matter of how we want to say that. Like, what's an easier way to say, like, so what we're getting at here is it's someone who's deceased within the time that you're applying for benefits. So I think, again, not a policy expert for medical, but my understanding is it could be up to 3 months prior to when they're currently applying for benefits.
So why don't we put that down, like deceased within 3 months?
Deceased within past 3 months.
Yeah.
It says that. It says eligible for some retroactive medical benefits. So
Yeah, but I think what we're talking about here with relabeling within certification period is the actual option that's being selected above.
Samantha said maybe maybe decreased within the past 3 months or before the end of the current benefit eligibility period.
Does that help to make more sense? I think it does.
Doke?
She says that still may be too technical, but maybe it's better.
So replace this existing text with that. Let's see.
The first part of it, deceased within certification period. Like, and I think we'd be looking to change the actual checkbox option as well.
Yeah.
Right. Well, would you replace it within certification period?
Within the past, Sam's whole suggestion, which is deceased within the past 3 months or before the end of the current benefit
Oh, I see.
eligibility
Oh,
period.
oh. So this is changing. I'm putting in the wrong spot. Okay.
I feel the same way Samantha does, and not making this too technical.
Yeah, that's a balance it's challenging to strike. How do we explain what it is without being too wordy, but also not being too technical?
I'll note that our temptation typically in these is to make it more wordy, which is always a little tough.
But sometimes that's very effective.
It's true.
So does that also include if you're still going to be filing married, filing jointly with a deceased spouse? And so that's technically you're looking at their tax filing status for that year.
That's the way I understand it.
So I would think that's, yeah, the before the end of the current eligibility period would cover that, I believe. Yeah, and again, like when we submit this, we'll make sure that medical policy is included and all policy areas really are included to make sure that everything we're adding here makes sense policy wise.
I think it's really great that we're really clarifying this because it's hard for people who have lost a loved one who has been on their benefits or on their taxes, and now they have to, what they don't really know within the year, how do they, when and why and all of this, because I know I went through this with my taxes. I was like, okay, do I file jointly? Do I file single? I don't know, it's so the clarification I think is good for people, even if it is a little wordy.
Yeah, I think the goal in potentially changing the actual option is helping people know that they should select that, because I think the pros to adding this as help text is we have more real estate to like be lengthier in these explanations. The con of adding it as help text is there's no guarantee that the user is going to look at that help text.
No, that's true. That's true.
So,
but some of these people who might be going through this may be doing this alone by themselves for the very first time. They may have had their spouse helping them or whatever, and so I think that if they do read it, great, it helps them.
Yeah, exactly.
So are we? So I just want to recap this part. So we're changing the text up here with this parenthesis, and there's a lot of space, so that shouldn't be too big of a problem. Although, and then leave this pop-up info text. Okay, I just want to make sure I'm caught up here. Although Maria, you just put something in.
Well, I wasn't thinking to necessarily change the kind of a checkbox text to make it much more wordier, but maybe it could try to find another word for. I think the certification is the part that kind of threw me off, but definitely like help keeping kind of the description in the help text is helpful. Yeah.
Yeah, we were going to lose the certification word.
Oh, good. That's good.
Yeah, so the newly proposed wording would be in the parentheses within the past 3 months or before the end of the current benefit eligibility period.
Mhm.
Right.
Very clear.
It's not too long. Okay.
I mean, it's longer than it is now, but I think again, I think what we have to strike a balance here is like making sure that people who should be selecting this option do,
Mhm.
and not assuming that everyone is going to be looking at the help text. 'Cause, so that's why I would
That's
lean
true.
towards maybe this expanded, making it a little bit longer.
We've got 2 more minutes before break.
Yeah. One thing before, I suspect we may go to a break before we do the third part here, but we started talking earlier and as a concern, it was brought up about should we be having extra text to encourage people to remove an individual from the case. I'm a little fuzzy on all that. But Andrew, did we get that covered, or this needs to be discussed?
We're jumping around a little bit. I'd suggest the text above, just if none of the provided reasons apply, consider removing this individual from your case.
That's what I was talking about, Andrew. Consider removing. So like, because I felt like sometimes they would tell us we need to remove them, or sometimes we will request to remove somebody. So that's kind of, yeah.
Yeah, I don't think we have, again, I don't know that I'm totally understanding, but I don't know that we have enough information here to like tell someone like definitively, like, yes, you should remove someone, or yes, you should include them. But that's part of the issue with these questions is like, if the answer is someone should just remove them from their case, we do want them to do that, but
Beyond would we need to change the title of the option or just add helpful information to understand the option? And then Maria says, keep it a little short if there's any other word for a certification period, and keep the additional description and help text. Susan said, we can just add bullet point, which is a good point. If this person should no longer be on your case, click on the remove member box next to their name. And then I'm thinking of people doing this on their own and not getting help from a community partner. And sometimes I could agree with that. A consumer would have to decide on their own.
Susan, do you mean in the help text add that, or like have it on the screen, potentially below this box or something?
Well, it doesn't seem like we can change the box, or it's a lot harder, so maybe just a bullet point with the question mark, the help text.
Okay.
With all the help text.
Yeah, I mean, it could be potentially added on screen, like outside of that box, like potentially below it, but in the help text is fine if we think that accomplishes what we want to do.
I think we should go to break and then come back.
Okay, well, mull on where this text, well, it sounds like it's gonna go somewhere around here, either in this info question or the info pop-up box or something like that. But yes, break, sorry. How about be
Ooh.
back at 12:14?
Pop-up bucks. I like that idea. Oh, okay. 12:14?
Yep.
Okay. Okay.
See you all back at 12:14.
Thank you.
Okay, everybody. Okay, is everybody back?
And we'll bring back the briefing sheet.
Bringing back everything. Okay, Andrew.
Okay, so I think where we left off is including some text. If the person should no longer be on your case, click on the remove member button next to their name. We can include that in help text. I didn't mean to shut down the idea of adding things elsewhere, just that if we're changing the actual options here, that's stuff that was determined by policy. So we just need a little extra, we'll need a little extra review on the end side of that once we file this. That said, we could put that extra text in the help text, or we could explore adding it on the page elsewhere. If we're going to do that, my thought would be dynamically, if they select no temporarily away or no, there would be some additional text, maybe displayed between, the upper question and the lower question, just saying like, if this person should no longer be on your case, click on the remove member button next to their name.
Now the notation where it says if that is not what is desired / appropriate, is that can we change that? Down the next paragraph. Yeah. Well, there. Okay.
I think that's just a note to us.
Yeah,
Oh, okay.
yeah.
Okay. All right. Good. Because I think, yeah. Okay.
Okay, so.
Okay, so if there's no more thoughts on that, we have one more section of text to review for yes part-time, and I'll put that in the chat. And then once we get this straightened away, George, we'll take a vote and then we can move on from this item. And I apologize, it's taking longer than we allotted for.
No problem. I just want to be able to get through the whole agenda.
Oh wait, sorry, ignore that text. I put the wrong text in there, so please ignore that.
At least it all fits on one screen.
Yeah.
So where do you want us, Andrew?
This time
what we're looking at on the screen there, and then what I just put in chat.
This is when, if the person is living in the household, they're saying yes, but part-time. Again, 8 options, 8 different options than we had before. And Andrew just put in these 8 items into the text, so you can play with the wording yourself. But take a moment to read through it and see if you have any questions at all, or if you have any suggestions to improve this text.
Well, it looks good to me. The only thing is, my question will be, is with the changing of the leader of ours, now wanting you have to work 20 hours in order to get SNAP. How's that
Yeah.
going to tie into this?
But isn't it work or volunteer?
Yeah, I think that's a great point, George. That doesn't have anything to do with this.
Okay.
So it's separate than what we're doing.
Yep, that's a separate. Well, first of all, it already exists for SNAP benefits. What they're looking at is including it for Medicaid. But yeah, that's a separate conversation than what we're talking about here.
Okay. Yeah, everything looks good to me.
You are a fast reader, George.
Oh, I am. Maria says, really good. Vanessa, how do you feel about this? Vixen? Susan? You guys deal with clients. April says looks good. Randy? You're welcome, Samantha. Arthur says yes. Brandy, I guess. It looks like it's working out, Andrew. Sydney says yes.
Great. Yeah. Well, there's no suggestions on wording here. Then all we need is, I mean, it sounds like most people are in agreement, but I don't know if you want a formal vote on everything that we've talked about so far with this item to move it forward.
Well, it looks like a
Um,
vote on it, so it looks like it works for the work I do with them. So it looks like that everybody's doing a thumbs up or good on it. So I think the only person I'm missing is, let's see. Is there anybody I'm missing? Judith, do you think so too?
Oh, yeah. Mhm.
And Vanessa? Yeah, she said yeah.
all right. I think we're good then.
And April, I vote too. April?
Yep.
Okay, well then you got your votes. And
Thank you, everybody. I know that one was kind of a marathon over the last couple sessions and certainly today. So really great feedback, and we'll get this one logged.
Great. Thank you.
Yay. All right, well, then that means there's more. At least it's a different request. In theory, we have, I gotta keep going because this is stuff we already did. Great, great. Oh, look at all that stuff we did. Good. And this is one we're skipping because of various things. Sorry, I'm going to just keep doing the vertical inducing scroll here. All right. And here we are then at request 80, the upload guidance language. So, Andrew, I guess, is this yours? So you're gonna take a breath?
This one is mine, James.
Oh, well, I'm sorry to take your thunder, Veronica.
So this one, I had an action item from last time. So to recap, this is the update. This is the upload document screen where we were looking to update the language just to make it more clear for directions on how to upload documents on that screen. My action item was to see if we can remove the virus scan sentence, so the very last sentence in the current existing language there.
Yeah.
And sorry, were you saying something, Judith?
No, I was just like, oh, yeah, I could see why we were taking that out.
So good news. The answer I got is we are required to do a virus scan, but we're not required to disclose that we are running a scan. So yes, we can get rid of the virus scan sentence, but we did have a question that we wanted to bring to this group. And that is, would it be confusing to get an error saying that your file is corrupt without mentioning or notifying that we are doing a virus scan? Because they will get a red banner or some type of error in there that will say that the file they've uploaded is corrupt. So if that sentence isn't there to warn them, will it be confusing to see that error if it does come up?
well, through experience, Veronica, any change like that, there has to be a notification. It's like putting a camera a security camera in a building without putting a sign up first. Because of the attorneys being involved. What do you guys think?
That's a tough one.
When the error message comes up, are we able to add something there? Or what does it tell us? I can't remember. Like, what does it tell us to do when the error message comes up? Like, does it say to upload a different file or?
I don't know the exact wording for it. I can look it up.
I think if it read, we sense something, an error in your paperwork with an X in the red, I don't think they would tip off the person doing the work that there was a virus detected.
No, I wouldn't. I would be very frustrated though. What would, I'm just thinking, what would they do if their document, a virus comes up and they get this, message that says, what? What does it say, Veronica?
I don't have the wording quite yet, but it does let them know that the file is corrupt.
If it tells them that the file is corrupt, that should be enough of an explanation. But if it says error, that's not enough. That I would be freaking out. I'd be like, well, now what do I do?
Yeah, it does tell them something. I just don't have the exact wording. I'm still looking for that.
Yeah, I'm with you, Judith. I remember doing something and then I just get a, nope, sorry, thanks.
Yeah,
didn't work.
just-
And you're just like, what happened?
Yeah, what'd I do? Is my computer, gonna burn up? I mean, I freak out when stuff like that happens. It's like, because I know nothing. I'm not like George who knows all this stuff. I'm just like, oh my God, there's nobody here to help me. Just. And then I haul my computer off to the computer shop and they charge me $300 just to tell me.
Vixen, Sydney, what would you say, Brandy? Vanessa?
How often does this happen?
I don't know, but I don't think it's something that the applicant portal team received a lot of calls about from what I remember. I think Paul and Maria are on the call, so if it is a recent issue in the last year and a half or so, you guys can speak to that. But as far as I know, it's not very often at all.
So if I had this that popped up that said, you have a virus or whatever, I hope they include call this telephone number or something, because otherwise, they're just going to be like, what happened?
Well, April says, I don't think so. Docs can be corrupt even without a virus. Vixen is as long as it tells them the doc is corrupt, I don't think saying error is a good thing. That's from Vixen. Vanessa says, agreed doc corrupt VSS error as any clarification as to why would be great. And then as error could mean a million of things.
I think it needs to be taken out because we're not giving them enough information to back it up.
Well, we haven't got the wording yet, so not.
So Susan, what would you do?
It looks like the error just says this the file contains a virus.
Which is what the virus detector, is going to say. So.
And now what do I now what do I do?
Well, that's what I was going to say, Judith, because if the system is able to give some advice on what they could do to fix it,
yeah,
that would be great. But maybe the system doesn't actually know. Maybe we don't actually know.
Well,
they could just call the number. Say, just call this 1-800 number.
Right. That I think, if you have, I think that would be appropriate. Because I know I've had issues something like this with Amazon. And they give you a number to call or an email to, a website to check with. And, and then they fix it for you. But, it's like.
Yeah, but what would they would just say, submit the document a different way.
Yeah, they would, but that would be better than thinking, is there something wrong with my computer?
Yeah, so we could look, Veronica, to adding the APTT phone number to that.
Are they the right number for this?
I would think so. I don't know. That's a good question.
Well, let's think about what this call is going to look like for the APTT, right? Like, because our customers aren't necessarily always the most technically savvy. Like, my dad has tried to use this website and he is not a technical person at all. So he's going to call the AP Tech team and he's going to say, hi, I got an error that my document has a virus. And like, Paul, I don't know what your team, how they would receive that, like what they would do with that.
So,
is that going to be
so Sam,
confusing?
here's what I can say about that. For as long as I've been here, I've never received a call like that, ever. So this is like minuscule of what we deal with. This is not something that I ever get. And I don't know when or ever somebody tells me that they got an error message with a corrupt file when they're uploading something. It's usually something else, and it's not because they've uploaded a corrupt file.
Does the AP Tech team have any like mechanism to resolve the corruptness of the file?
No, that's going to probably end up as a ticket anyway. I mean, if it comes up as a corrupt file, we're going to ask them to send us the error message screenshot, and we're going to upload it and send it all the way up the ladder anyway. So, I mean,
yeah,
I don't know how that would ever get resolved. I mean, other than when I'm doing like, for example, an identity proofing and they're snapping pictures, and they're doing it off their phones usually. I mean, few and far between people are even scanning things into a computer anymore. I mean, they'll snap it on their smartphone and send it. I mean, unless their phone's completely corrupt, And if that's the case, they're not going to make a phone call anyway. I mean, they've got bigger problems than anything we're ever going to experience. So, I mean,
I just, yeah, I wonder if the correct solution is sending them to AP Tech team. Like if AP Tech team even, like you said, Paul, they're not going to make a call. Like, do we want to give them the other ways to submit it, or do we want to send them to a call where all AP Tech team can do is submit a ticket and say like, yeah, you probably should mail that in, guys.
exactly. And that's basically it. So,
Well, maybe not the tech team, but just the standard customer service. So they talk to like an eligibility worker that can say, yeah, go ahead and text me your documents or email them to this email as opposed to uploading them. Or bring them into an office.
Yeah, that's good too. Yeah.
But again, do we want them to get on a call, wait for 45 minutes? We know the phones have been a challenge over the past 2 months with them being down a lot. Do we want them to wait on that call for 45 minutes just to hear, yep, mail it in? Or should we just bypass that entirely and just tell them, hey, submit it through a different way because you can't upload it?
Well, then why not just finish this paragraph with mail in your document?
Or list out the ways that they can do it alternatively.
Well, how I would do it is if the document came out corrupt, give them other options. Like what Samantha was suggesting, email, mail, or fax. Give
What's
the
that?
consumer
Fax.
Give the consumer options. If the document
You
is
would be shocked, Judith, but we do still get fax. I know it's like the 1980s in our offices sometimes, but people use it. People legitimately go fax us stuff.
Well, yeah, they can go to the UPS store and fax it.
Veronica, when you put the fax up there, you might want to put the fax number for a consumer to fax it to.
Yep, I've got that number. So one thing that I can think of if we received a phone call with this type of error is asking the user to resave their document and upload it a second time, because usually it's not an actual virus in the document. It might have just been saved funky, came in through a zip file or something like that. So Paul, that's one thing that you can have the team do is have the caller ask to resave the document and then try uploading again.
okay.
Now, one way that would make it seem that the document would be corrupt would be cookies, because cookies on a website, they talk to each other, which not many people know that they do. And that would also become a document that would be corrupt. In order to have a website, you have to have the cookies, or else the website never works.
So are we updating just the text on the screen here, or also the error message? Because currently the message just says the file has a virus.
I would put it down on the bottom where it says verification document. That's what I would do.
Okay, it sounds like maybe we want to update it in both the error message and the text.
Veronica, I think removing that, each document submitted here is okay as long as we can update that error message.
Yeah, that could work if the group agrees on that.
Guys, are we all in agreement with that?
Sounds good.
Okay, got one vote. April? Brandy? Susan, okay. Oh,
I think Susan wants us to restate what we're voting on.
So Maria's suggestion was if we update the error message to be more clear, then we can remove that last sentence in the existing language that says each document submitted will be subjected to a virus scan.
Good idea.
Yeah, but update the message to, it's just like a red thing, isn't it? It's like when you try to upload a JP file and it should be a PDF, it just says in red something. So what are we actually doing?
I don't think we had a suggestion for the updated text. So do we want to discuss that real quick?
well, we've got 11 minutes or 16 minutes.
Veronica, I just put in chat, like for the error message, maybe we could also include that, each document submitted will be subject to virus scan. And then some other ways to submit your document is.
I like Maria's suggestion, and I think, given how much more we have on the agenda, maybe we can take this back as an action item and bring back some suggestions on the error code text. Looking at what Maria put in chat and brainstorming a little bit so that the group has something to react to for next time.
We can do that. Andrew, you up for that?
Oh no, this is still Veronica's job.
Oh,
It's still
Hold
my
on,
job,
George.
yeah. So yes, I'm up for it.
sorry.
You're fine, George. I know you want to assign things to Andrew, and that is also my favorite thing to do. But this one for Veronica.
I'm still learning of whose job is what. Sorry.
It's entirely vibes based, George.
Veronica, you're okay with this?
Yep, so I'll take the action item to bring back some suggested wording for the error message. Are we good with the rest of that paragraph text, or should I take an action item to bring some suggestions for that as well?
Well, you got Samantha liking it, Dixon, Brandy, Susan. Haven't heard from Veronica yet. Or I'm sorry, Vanessa, Brandy, Dixon, April. April, are you okay with this?
Yeah, looks great.
Yeah, let's go forward. So we'll do it on the next meeting, then we'll have it as an action item.
Yep, so in the next meeting, I'll bring back some possible suggestions for that
Good.
error code wording. Yeah.
Okay.
Great.
Okay. Everybody's in agreement with it except for. Okay. We'll just do it at the next meeting, right?
Yep.
Okay.
All right. Well, I'm going to stop sharing that. Thank you for your work on it. It's always a little more than we expect, but that's normal. On our agenda, we had a couple of things before we wrap up, and ignoring what I just said, maybe they'll be quick, but I'll share. First of all, there's the flyer that we've sort of off and on talked about the last couple months, and did a bit of a rework on it after a quick conversation with Judith, and it was sent out with the agenda, but I think we're a bit closer to where we need to be. One clarification that I didn't have in my head when I was creating a draft was that this is more of an online thing, not an actual piece of paper that people have. And so we dropped, if you remember, there was the QR codes that took up a lot of space at the bottom. So we took those off. If this is not a paper copy that people are working with, then it makes sense to just use links. And yeah, this image comes from, if you've looked at the beginning of our presentations, I just totally copied and pasted and stole a bit from our standard ODHS people shot. So if people want more time with it, it could be a homework assignment, but if, we've looked at this a few times, so you can take a look and see if you can catch all the mistakes I put in cleverly to make sure you're proofreading properly.
Oh.
Looks good to me.
I like the graphics that you pulled.
Okay, good.
Yeah, looks good.
I'm happy with it.
Actually, one other thought too, while you're looking at it, if I can, there we go, is we've got the new ODHS logo. How about that? And maybe I can sneak in a slightly different Dean-centered logo if you don't mind. I can put that at the top as well for Samantha's former office mate.
Oh.
Well, for me, if it was me, I wouldn't put in too many logos.
No, it would replace the. I was gonna point to it. That's all. It was gonna replace the. I think the OEP logo in the upper right, or maybe the one. I forgot which one is better, Samantha.
Oh, we have lots of options. Don't worry. I will send you a variety of graphics.
Okay,
James.
sounds good.
I really like how you put the wheelchair and everything in here to get everybody involved. That way, well, to me, it would feel like
Includes?
you're included.
That's right.
Good. Well, that was Judith pointed that out. So thank you for that.
Does everybody here in the committee like this? Are we approving this, James?
Sure. Well, let's.
He's going to put a different headline on it, aren't you?
I'm gonna put some different images in.
Yeah. So.
But
Oh.
So but anyway, I should probably do this another time. But I was thinking of, we'll replace this one with I need to see, this is what I keep thinking, oh, I'm gonna do this really quick, and it never quite turns out that way. Let's just leave this out for now. But
it's never quick, James, when you're editing live.
Yeah, when you're editing for an audience, yes. But anyway, how about this? Sounds like got support of the committee. I'm not going to make any changes except for the aforementioned slight logo changes, and we'll email it out to you all. And if if some other little change comes to mind, feel free to email me. But I think we'll have a final version then for next month that you can share with the world, and we can put on our website, things like that. And then I'll start a timer to see how long it takes before communications gets mad at me.
Cool.
James, when this gets approved, I would suggest putting a counter up so you know how many people are actually reading this.
I think comms can do that. That would be that is a good idea, and I need to ask them more often about that. And but I would encourage you all to share it as well, and we won't have a counter.
Yeah. So like I'm going to have a table in a couple of weeks at one of the Walmarts, and I'm going to be doing an ADRC, and I'm doing also parking regulations. And see, I could print out a couple of these and have them on my table. So be easy.
Cool. See, that's an example. Oh my gosh. So anyway, yeah.
James, we're going on a fun little trip on Friday to visit our friends in Grand Ronde. I would love to bring this to that as well.
Oh, that'd be great.
Well,
Wouldn't
there you go.
Yes, it would be great.
I think this is on the this is actually on the action items list I dropped in for James and Andrew last week when I wasn't feeling well. I was like, don't forget all these action items. I'm out. Bye, guys. So there we go.
Awesome. Yeah.
Great.
I'll be ready this afternoon.
I do have, and I've come up with an idea. Once this gets done and everything, if from some reason put it on advertising, and what if other people from other states would look on what we're doing? That would be even bigger.
Yep. As a matter of fact, I almost feel guilty about, well, I shouldn't say almost. I definitely feel guilty about this because I am going to go to a conference and talk about this group among a few other things. And so I am totally writing all your coattails and I get to go to a conference and talk about it. So,
what conference is it?
Oh, it's the American EPHSA, something Human Services Association.
Oh, okay.
Is it ISM?
Yeah,
in
it's
October
ISM.
in Reno? Oh yeah.
Yeah.
That's the one I went to last year, guys, where I ditched you all for that, and the year before actually. I've ditched you 2 years for that. So that's exciting, James.
Yeah, yeah. And so I was just working on a presentation, which is due very soon. But yeah, it's conferences next month. So yeah, so I'll definitely be plugging this. And I think I mentioned not last month, but the month before that our director, Sarah Boris Pakshara, presented about OIC at a national conference. You know, I'm sure he presented about a lot of stuff, but he talked about the work of this group as well, and there was some interest. So.
Well, with him retiring and a woman taking his place, I think that we might have to get her interested. Since
Yeah, that's going to be my question for when I summarize our work for this month. Is you know, is Liesel going to be getting these reports and how interested she is? So we'll see.
I have found the best way to get interest with our directors is to make an appointment and they face on. I go to their offices and talk to them. They, you know, and it's, I just find it's better. Hey, I have a question here. It's a very important professional question.
Uh-oh.
How's Bean doing?
Oh,
We haven't heard from Bean.
Bean clocked out a couple of months ago. She was 7, and that is a substantial age for a guinea pig. But she made it to the day after St. Patrick's Day. She got to try corned beef. She got to have lots of fruits and vegetables, and then she clocked out for the last time. So she's in our hearts and in our energy for sure, because she was a very spicy lady and she would not let us do any less. But yeah.
Oh.
Yeah.
Sorry for your loss.
Yeah.
Thank you.
Our little Beanie.
Our sweet little lady, yes.
Mm-hmm.
She was here from the inception
I know,
of OIC, original member.
She was our mascot.
Yeah, truly, truly. Yeah.
Okay.
Well.
So James, how far down are we on the agenda?
We are plugging along in a shocking development. That was about, you know, the amount of time supposed to take. I think we're very close to the end, though. I will say, let me bring up, just as a glance, Brandy and I had a nice meeting to talk about the feedback survey, and I think it was April last month who suggested, well, why don't I just, create a timeline and then put significant events that have occurred in the last, over this time period. And so you get something a little, a little messy. So we don't really have time to discuss. I'm just gonna just ask you to, think about this. But if you take all the data that we've gotten, and here are the three questions. Question 1, 2, or 3. How? Gosh, I'm trying to remember the question. How helpful was the ONE system? This is the survey that people have the option to get anytime they sign out.
Okay.
How helpful is it? Did you use the tools? Was it understandable? I think those are the three questions. As you can see, they're pretty highly correlated, and so and also if you look really closely, you can see these other lines in the background that spike up and down and stuff. That's actually the raw data. I smoothed it out a bit by averaging it over 7 days. It's still a little bumpy. This black line down here is the number of surveys we got per day. Again, that is also smoothed out because on the weekends we don't get very many, and on Mondays we get a lot, that sort of thing. So it's a mess. It's the short version of it. And I suspect we're not going to see any big correlation from things. But nonetheless, I still think it would be a nice idea to have a timeline for the things that we did. And Andrew kindly also created a list of major change requests over the last 6 months as well that we can stick on. So there's all I guess I'm asking is, and this is not going to be anyone's top 1 or top even 5 things to do, but just think about how could we present what we've done and this survey data in a understandable fashion. And if you have any brilliant insights, I'm all ears. So that's all we basically have time for on this item. I just wanted to show you some of the work that we're putting together. Yeah, George?
Well, from this data, it will give us some idea of maybe some improvements within a certain period. And then once you get more data, compare 2 together, it would give us maybe an idea of a lot of things, I would think.
You think? I don't know.
And the work we're doing.
I mean, I'm also tempted just to take a couple of the questions out too, and just because they're sort of correlated with each other, and so it'll make it less messy if we just have one question response. But I don't know.
Bye, April. Yeah.
Okay, I'm gonna stop cluttering up our screen with this.
Yeah, I think this is a good idea, a good start.
All right. So
yeah, we get data down in ValLift down here. We get bar graphs and stuff that gives us an idea of how many consumers we have writing on the system and a whole bunch of stuff. And it helps my committee that I chair on to get an idea as to what the next step could be, what's working, what's not working. and gives us an opportunity to work on it. You'll look nice, Dion.
Sorry, I was actually just trying to look at it like, what the heck? I forgot my camera was there.
I was wondering what you were showing off to us. He was holding up some candy. But in any case, we got a lot done. That big old nasty request 77, I think, has been put to bed, although I'm sure we will come back to it as the screenshots and everything come together. And we also have a couple follow-ups then with request 80, but it's close to being done. I am happy to see that. And we do have a few other requests that are in the briefing sheet that now that we're done with the big old nasty 77, I think we'll start plowing through those a little quicker. And hopefully we'll have a few more items to work with or a few more mock-ups for the feedback survey graph too. That's my quick recap. What am I missing?
Are we getting stronger and more requests coming in?
Not a ton of requests coming in. We have a few that are trickling in. But, yeah.
And Samantha, while you're on here, how are you and Andrew working on the security system like the CAPTCHA?
The CAPTCHA issue is a little bit on hold right now. There was a part of ODHS communications that wanted to be involved and asked to kind of take over that. But things have been a little exciting at ODHS over the past few months, a little bit spicy, so they've had to put a slow hold on it. We're hoping to pick it back up later this year and get moving with it.
Do we have anything to replace it?
Not right now, just because it's been on a hold while they deal with some of the more, how do I want to say this? Time sensitive issues that communications needs to deal with. Unfortunately, we don't have a dedicated communications person. We share them with a couple of other projects. So we take their time where we can, but also understand that we can't always be number one. Number two, though, minimum number two.
We are number one.
In our hearts, we're number one.
Well, we're the one system.
We are the one system.
I'm gonna tell Deb that line.
You think we'll have it before December?
December, it sounds. Oof.
Maybe. I don't want to say no because sometimes things pick up and they go, you know? But I don't want to say yes. Let's give it a firm maybe. I'll give you a 50% chance on that.
Okay. Does anybody want to ask questions or concerns before we log off?
Well, it's 102, Chief.
I do want to say to James and Samantha, Andrew and Dion, I think from what I'm hearing, the people in the state offices that are on the one system needs to be trained different. Consumers are still getting this, I don't know stuff. I wanted to bring it to your attention. I'm hoping it can be corrected in every state office.
Yep. I'm gonna chime in. I know we're way over, but I'll say, when I first came here, I was like, hey, we should change this, we should change that. And I have come around to realizing all these changes create a lot of stress on staff, and it's more stuff for them to learn too. And so that's part of it. So the system, doesn't stay still very long for people to learn it because we're always updating it, and we should. But yeah,
I will say, George, I brought similar concerns to some of the OEP Central Business Office team members a couple of weeks ago, and they are also tracking this as an issue and also working on plans. So it's out of my swim lane. Sometimes I get nosy, George, and I have to go ask questions, but I have been assured that plans are in the works, and so stay tuned.
Okay, Vixen had a question, right?
No, I was clapping for you, George, because I feel like sometimes when I call, I feel like I'm having to help whoever is at the CP line. And I'm like, because the other day I had a call and it was interesting because I said it was a person I had done veterans dental and they were like, well, we have to have an interview. And I said, why do we have to have an interview? And he said, well, because he's getting SNAP benefits. I go, no, we're applying for veterans dental. He's way over for SNAP benefits. Well, we have to run him for SNAP benefits. I'm like, no, we don't. And they were like, well, I'm going to have to talk to a supervisor. And I'm like, please do. And then I was on hold for again. And then she was like, got back on and it was like, oh, you're just doing veterans dental. Yep, that's what I said. So I agree that sometimes things do work really fast, but I also feel like if we're going to be in those positions, we have to be hanging on and doing real fast work with them, or admitting, even if you say, oh, can you, like, if that CP person would have just said to me, okay, can you explain a little bit more and just admit, I don't know for sure. I'm good with that. But to like tell me I'm doing wrong and I'm like, no, that's where then it gets kind of frustrating. And in all honesty, if I hadn't been on hold for literally 57 minutes, and the day before I was on hold trying to get this one case taken care of, I would have hung up. So, but I didn't. So I was clapping to you, George.
Okay.
Thank you for your persistence, Dixon. And
Yeah,
I apologize
thank
that you were on hold that long.
Yeah.
It's okay. I know that things are, I finally messaged a friend that works and I was like, will they pick up the phone? It's like, and they were like, yep, don't give up. I was like, okay. Because I started at like 4 something and it was like 5 something. And I'm like, they didn't all leave me, right? Well, there'll be a prompt that says, sorry, today's not your day. But anyways, they picked up finally. So yeah, I'm okay. It's okay. Cause I plan for that. It's just, I will agree that I think if you're a new assister or a community member trying to navigate this and you end up calling the numbers and you end up with that barrier, I can see why people give up.
Yeah.
Thank you for,
Yeah.
okay, well, I will see you all next month in September. Be safe, stay where the viruses are, and I'll see you next meeting.
Thanks, everyone. Thank
Bye.
you.
Thanks, everybody.